it'll be a fast and furious presentation because what we're going to see here over the next month or so is unfortunately going to be very fast and furious. So we have a double feature, and you'll see why we're going to be talking about ducks here at the end. Next. As Matt has pointed out, been looking at several countries as ahead of us in terms of Omicron outbreak as a way to gauge what we might expect. I think Denmark and the UK have the biggest head start, and for a lot of reasons, the best data. And you can see that their Omicron waves are still going strong, and that they are well above where the US is, although we've started, obviously, our rocket-like upward trajectory as a country, and that's been going on the East Coast and New York for a while. But you can see that the UK and Denmark are still well over twice what we are in terms of their cases per population, and it's unclear whether these little dips they've had recently are just anomalies of reporting over the New Year holiday, which I suspect they are, or whether they've started to reach an inflection point. We'll know over the next several days to a week, but clearly we have a lot of ceiling to go as a country, and when you look individually at states and localities, it will be even greater. Next. Obviously, one of the phenomena that we've been following is this idea of very, very high case rates, but low hospitalizations. And that decoupling, while still true, is starting to break down a little bit in the UK and Denmark. You can see that their hospitalization rates are now higher than they have been at any point since last winter's wave. So certainly surpassed anything that they've experienced with Delta in the UK and Denmark. And those hospitalization rates are still going up. Now, still proportionally a small increase compared to the overall case increase. So we are seeing that decoupling still, but there's certainly a surge in hospitalizations that we're seeing in those two countries. Next. And I think important to keep in mind that when we're comparing ourselves to those countries, we have to remember that both Denmark and the UK have much higher vaccination rates than we do. And particularly when we think about boosting, which we know provides the best protection against infection and certainly is important for protection against hospitalization in senior citizens and the vulnerable. The UK, you can see, has a much higher rate of boosting in people over the age of 50. Over 90% of their citizens over the age of 50 are boosted. And you can see that in the US, it's fewer than half in that age group are boosted in the US. And Matt just showed you the data for Nebraska, and we're relatively in line with the rest of the country, where the majority of our most vulnerable and certainly the majority of the population is not boosted and thus optimally protected. Next. What we're seeing here in the US is obviously now, as I mentioned, that rocket trajectory of case counts going up. We just, for the first time since the pandemic started, broke the 1 million cases in a day mark for yesterday. And so now our daily average, which if you remember back in last winter in January, our peak was, I think we achieved 300,000 cases on a couple of days during that peak back in January of 2021. Now in January of 2022, our average is already close to 500,000 cases a day. And that's going to continue climbing, sadly. So we are going to blitz past our previous case records, already have, and that's going to continue going up. Next. Now, what we're seeing across the East Coast, which is where Omicron has the biggest head start, is not only record case numbers, and you can see all of these graphs have percentage of previous peaks, and you can see New York is well above 400% of its previous peak. And as are places like New Jersey, Washington, D.C., et cetera. But look at the hospitalization curves there, that curve that's just down there for many of these locations, New York, New Jersey, Washington, D.C., they have already surpassed their highest hospitalization rate for COVID than they saw previously. You can see Washington is over 200% of what their previous peak was. So that's a huge jump in hospitalizations, and not nearly the decoupling that we're seeing in the UK and Denmark. And again, this, I think, reflects the fact that we have much lower vaccination rates and much lower boosting rates in the most vulnerable than we see in the UK or Europe. Next. We can also see that overall across the country, our hospitalization rate for COVID is now higher than it was at the previous summer surge with Delta variant, and is now approaching what our overall peak hospitalization rate for COVID was back in January of 2021. And I think Matt pointed out some of these data as well. Next. When you start to break this down, what's concerning is we're seeing increases not only across all age groups, and you can see here from that top arrow in the highest age group of 70 years and older, but that lower arrow points to kids 0 to 17 years old. And you can see this is really the first time at this scale that you can see that hospitalization curve move above what would be kind of a baseline, because we're seeing so many more hospitalizations in kids. Next. So if you look at that, this is Region 1, which is New York and New Jersey. You can see that their previous maximum of pediatric hospitalizations for COVID-19 was about 0.3 per 100,000, and that was in the spring of 2021. That was when Region 2 had a bit of an alpha wave where they had higher case counts than a lot of other places. But you can see now that we're over 4 times that rate of hospitalization for pediatric cases in Region 2, and still going up again like a rocket. Next. If you look at Region 3, which is the Mid-Atlantic now, that's Pennsylvania, Maryland, Virginia, et cetera, Delaware, you can see that they are also going up like a rocket with pediatric hospitalizations. They are now double what their previous peak had been during the recent Delta wave in the late summer, early fall, and now they are well above that. Next. So there's this idea, and Dennis pointed it out in the chat, and I knew this was going to come up because this is the latest trope that's being circulated around by the disinformation Nazi. That is, we're seeing all these hospitalizations because people are admitted with COVID and not because of COVID, right? You can kind of, you can predict when these talking points are going to come out because they start in certain segments of the metaverse now, and they quickly become kind of the rote talking points for all of the people who are anti-vax, anti-mask, and anti-science. So this is the latest. Now, certainly if there are increased community case and transmission rates, you're going to just by probability see increased numbers of people in the hospital who have incidental positive COVID findings. And we've seen those since the beginning of the pandemic. Certainly we've had trauma cases come in who test positive, who are not admitted because of COVID. But the majority of patients, certainly we're seeing in our hospitals, are admitted because of a syndrome that is consistent with disease caused by COVID. And if you look at areas where they're seeing very high community transmission rates and hospitalization rates right now, as in Maryland, it's not just that they're seeing more COVID patients in the hospital, they're seeing more patients in the hospital in general. So they are overwhelmed by total patient burden and further hamstrung by staff absenteeism that is at a peak for the pandemic. And therefore, many hospitals, at least as of last night, 6 hospitals in Maryland have already declared they are in crisis standards of care because they are completely overwhelmed. If you look at ICUs in Maryland, more COVID cases in the ICU than they've ever had in the history of the pandemic. So hard to, I think, say that you end up in the ICU because of your, with an incidental COVID, right? If you're in the ICU and you have a positive COVID test, it is very likely that you're there because you have COVID that precipitated some major catastrophic physiologic syndrome. So I think that this is a predictable talking point that you'll see from the disinformation army, but it's one that we need to push back on. Hospitals are being overwhelmed, and that's not because, all of a sudden lots of people are falling and they happen to have a positive COVID test. It's because COVID is putting them in the hospital.